All right, so now health officials in Wajir say they're still on high alert despite the reduction of the number of cholera cases in the county. Wajir County has enlisted 858 cases of cholera since the outbreak was first reported in November last year, but now remain with only 8 cases after an extensive campaign by the county health officers and the Kenya Red Cross. Hamid Hussein with the details from Wajir County.
It was in November last year when Wajir County reported the first cases of cholera outbreak. The county has since enlisted 858 cases for the disease and 15 deaths. Despite majority of the deaths being at community level, the county partnered with the Kenya Red Cross and has since closed 6 CTC centers and remains only with 8 active cases.
We were able to manage the control of cholera across the county, and as at now, we have nil cases, 0 cases in Wajir South, 0 cases in Wajir East, but we have 3 sub-counties which have just came up with the cases. That is Wajir North, specifically Buna, where we have 7 cases, and Eldas 1, and Arbajahan, which now they are at 0 now.
The Kenya Red Cross had in January this year rolled out a 3-month response activity in relation to the outbreak, which has seen the cases massively reduce.
So far, cases have drastically reduced in Wajir North, specifically Buna, where we have responded. We have engaged community volunteers who are going door to door, sensitizing community members, together with Kenya Red Cross volunteers, and it has yielded a positive result so far.
But specifically for Red Cross, the issue of community engagement really worked, because that is where the main challenge we initially had, which was somehow beyond our capacity when we found that we were overwhelmed. But when Red Cross came in with the community engagement, the numbers drastically came down, and we were able to control and close those centers.
Through community engagement programs, the Kenya Red Cross teams were able to sensitize the public on the importance of maintaining hygiene at the household level.
We'll be supporting the CHVs in Allahs, and we'll also, with the help of Kenya Red Cross volunteers, we'll ensure that we will do extensive community engagement in Allahs and Arbajahan and any other places that we suspect like there might be cholera cases.
The county health department, in partnership with Kenya Red Cross teams, strengthen coordination units and heighten surveillance to curtail the spread of the disease.
We have trained community health volunteers at any place in this Wajir County, at any village. So these community health volunteers know bits and pieces of this and that, and they know how to engage the communities. So we emphasize them, we train them, we have sensitized them, so they do house-to-house activities.
The cholera outbreak in Wajir County was initially caused by the drought and later by the floods after the heavy rains, as herders consumed contaminated water. However, despite the reduction in the number of cases, the county is monitoring events in various sub-counties and remains on high alert. Hamid Hussein, KT News.